What exactly is cholesterol? And why should I be concerned about it? Cholesterol is a waxy, fat-like substance that's found in all the cells in your body. Your body needs some cholesterol to make hormones, vitamin D, function of the brain, and substances that help you digest foods. Now, you might have heard about LDL and HDL cholesterol.
Always consult your doctor before making any changes to your medication or major changes in lifestyle.
LDL, often referred to as bad cholesterol, can build up in the walls of your arteries and form plaques. These plaques can narrow the arteries and limit blood flow to your heart. On the flip side, we have HDL, or good cholesterol, which helps to remove LDL from your bloodstream, preventing it from building up in your arteries. Pravastatin, a member of the statins family, is a prescription medication that aids in regulating cholesterol levels. Now let's dive deeper into how pravastatin works. The body is a complex machine, and cholesterol plays a key role in its functioning. However, too much of a certain kind of cholesterol, known as LDL or bad cholesterol, and triglycerides can contribute to the buildup of plaque in the arteries. This can lead to heart disease, stroke, and other cardiovascular events. Enter pravastatin. Pravastatin works by inhibiting an enzyme in the liver that is responsible for producing cholesterol. By slowing down this process, it reduces the amount of LDL and triglycerides in the bloodstream, but that's not all it does. Pravastatin also helps increase the levels of HDL, or good cholesterol. HDL works to remove LDL from the body, further promoting a healthier balance of cholesterol. This dual action of lowering LDL and triglycerides while raising HDL makes pravastatin a valuable weapon in the fight against heart disease and stroke. It is often prescribed to those with high cholesterol or other risk factors for these conditions, helping to reduce their risk and slow the progression of heart disease. However, like any medication, pravastatin is not for everyone. It's crucial to have a thorough discussion with your healthcare provider before starting this medication. Individuals who have had allergic reactions to pravastatin or any other medicines, have liver or kidney issues, are trying to conceive, are pregnant or breastfeeding, have lung disease, regularly consume large amounts of alcohol, have an underactive thyroid, or have had a muscle disorder, may need to avoid this medication. While pravastatin is beneficial, it's important to know who should avoid it. The journey to better health is a personal one, and understanding how medications like pravastatin work is a vital part of that journey. Before starting pravastatin, it's essential to consider certain factors. This medication isn't for everyone. For instance, those with liver or kidney problems need to be wary, as pravastatin may exacerbate these conditions. Also, if you're trying to conceive, are pregnant or breastfeeding, pravastatin isn't recommended due to potential risks it may pose to the baby. Consider your lifestyle too. If you regularly drink large amounts of alcohol, pravastatin may not be the best fit for you. The same goes if you have an underactive thyroid or a muscle disorder, including fibromyalgia. It's crucial to discuss your full medical history with your doctor before embarking on a pravastatin regimen. This includes any allergies you may have, even to other medications. Remember, your health and safety come first. Always consult with a healthcare professional before starting any new medication. Now that we've discussed who should be cautious, let's look at the benefits and side effects of pravastatin. While pravastatin has numerous benefits, it's also crucial to be informed about the possible side effects. Pravastatin, a member of the statin family of drugs, is often prescribed to help maintain healthy cholesterol levels. But how does it benefit us? Firstly, pravastatin lowers LDL, which is often referred to as the bad cholesterol, and triglycerides, both of which contribute to the formation of plaque in our arteries. By reducing these, pravastatin helps keep our arteries clear, promoting a healthy blood flow. Secondly, pravastatin has the ability to raise HDL, the good cholesterol. HDL's job is to pick up excess cholesterol in your bloodstream and take it back to your liver where it's broken down. So a higher level of HDL means less cholesterol in your bloodstream. Lastly, by managing your cholesterol levels, pravastatin reduces the risk of heart disease and stroke and can slow the progression of heart disease. This can be a significant benefit for those with high cholesterol or other risk factors. However, it's important to note that, like all medications, pravastatin can have side effects. The most common ones are usually mild, such as muscle pain, headache, nausea, upset stomach, constipation, and diarrhea. These typically resolve on their own, but in rare cases, pravastatin can cause more serious side effects. These include rhabdomyolysis, a breakdown of muscle tissue that can lead to kidney failure, liver problems, increased blood sugar levels, and memory problems. If you experience any of these, it's important to reach out to your healthcare provider immediately. It's also worth noting that the severity and type of side effects can vary from person to person. Factors such as age, overall health, and other medications you're taking can all play a role. So while Pravastatin does come with some potential side effects, it's important to remember that it's prescribed because the benefits, such as reducing the risk of heart disease and stroke, often outweigh these risks. As you can see, while there are side effects, the benefits of Pravastatin can outweigh them. However, it's always best to discuss these benefits and risks with your healthcare provider to make an informed decision about your treatment. It's important to understand that Pravastatin can interact with other medications. And when we say interact, we mean that the effects of Pravastatin can be altered, increased, or decreased when used alongside certain other drugs. This is why it's essential to keep your doctor in the loop about all the medications you're currently taking, including over-the-counter medications, herbal supplements, and vitamins. Now let's dive a bit deeper into these interactions. Certain blood thinners, such as warfarin, can interact with Pravastatin. If you're on this type of medication, the effectiveness of either drug can be altered, potentially leading to increased risk of bleeding or decreased efficacy in controlling your cholesterol levels. A medication called gemfibrozil, often used to lower fat levels in the blood, can also interact with Pravastatin. This interaction can increase the risk of a condition called rhabdomyolysis, which is a severe breakdown of muscle tissue that can lead to kidney failure. Other medications that can interact with Pravastatin are cyclosporin, a drug used to suppress the immune system, clarithromycin and erythromycin, which are antibiotics, and nefazodone, an antidepressant. These drugs can increase the amount of Pravastatin in your blood, leading to an increased risk of side effects. Even something as simple as grapefruit juice can interact with Pravastatin. It can increase the amount of Pravastatin in the blood, which can elevate the risk of side effects. So it's best to avoid grapefruit juice while on this medication. These are just a few examples of potential interactions, but remember, the interaction can vary widely depending on the individual, the dosage, and the combination of medications. This is why it's critical to discuss your entire medication list with your healthcare provider before starting Pravastatin. In conclusion, while Pravastatin is a beneficial drug for managing cholesterol levels and reducing the risk of heart disease, it's essential to be aware of the potential interactions with other medications. The key is to communicate openly with your healthcare provider about all the medications you're taking to ensure safe and effective treatment. Remember, always keep your doctor informed about any medications you're taking. So, what are the key takeaways about Pravastatin? In a nutshell, Pravastatin is a prescription medication that belongs to the statin family of drugs. It's primarily used to lower cholesterol levels in the blood, specifically LDL, which is often referred to as the bad cholesterol, and triglycerides. Notably, it also has the potential to raise HDL, the good cholesterol. Pravastatin is a key player in reducing the risk of heart disease, stroke, and other cardiovascular events in people with high cholesterol or other risk factors. Pravastatin, however, comes with its own set of precautions. It may not be suitable for those who've previously had allergic reactions to it or any other medicines, have liver or kidney issues, are trying to conceive or are pregnant or breastfeeding, suffer from lung disease, consume large amounts of alcohol regularly, have an underactive thyroid, or have a history of muscle disorders. The benefits of Pravastatin are significant. It lowers LDL cholesterol and triglycerides, raises HDL cholesterol, reduces the risk of heart disease and stroke, and slows the progression of heart disease. But like any medication, it has potential side effects, which can range from mild issues like muscle pain, headaches, and upset stomach, to rare but serious problems such as rhabdomyolysis, liver problems, increased blood sugar levels, and memory problems. Pravastatin can interact with other medications, increasing the risk of side effects. Some medications that can interact with Pravastatin include blood thinners like warfarin, gemfibrozil, cyclosporin, clarithromycin, erythromycin, and nefazodone. It's crucial to inform your doctor about all the medications you are currently taking. Remember, if you stop taking Pravastatin without starting a different treatment, your cholesterol levels may rise again, increasing your risk of cardiovascular disease. Pravastatin should not be taken during pregnancy or breastfeeding and should be used with caution in people with liver or kidney problems. Also, avoid taking Pravastatin with grapefruit juice, as it can increase the amount of Pravastatin in the blood, which can increase the risk of side effects. As always, it's important to have open discussions with your doctor about your health. They can help determine if Pravastatin is the right choice for you. Up above you see 1 or 2 videos which may help you. Also, don't forget to click the like button and subscribe.